Ontario's top doctor says he will recommend the Ford government take province-wide measures to combat the rapidly spreading Omicron variant. Dr. Kieran Moore says the regional approach to COVID-19 was designed with the Delta variant in mind, and Omicron poses a different threat, with a single case of Omicron now infecting 4 to 8 times more people than Delta.
Dr. Moore says an announcement will come later this week, while a government source tells CP24 the Premier will make an announcement tomorrow, and it will be about COVID-19 booster shots. Joining us live tonight to discuss, infectious diseases specialist at University Health Network, Dr. Abdu Sharkawi, internist at St. Michael's Hospital, Dr. Fahad Razek, who's also a member of Ontario's COVID-19 Science Advisory Table, and Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital. Thank you all, doctors, for making time for CP24 tonight. Dr. Sharkawi, what were you anticipating to hear from Dr. Moore today, and what are you hoping to hear from the Premier tomorrow?
Well, I was anticipating a certain level of sobriety regarding what we're dealing with right now with Omicron marching through Ontario quite predictably, as it has through pretty much every other major jurisdiction in Europe and other parts of the world. What I'm hoping to see, honestly, from Premier Ford and others going forward is a sincere commitment to trying to help the everyday person make an informed choice about their behavior. I think everybody is extremely fatigued at this point. It's very difficult to go back to square one in terms of where we were in March 2020. People need the bonding, the social, emotional, mental support of people who are close to them. And expecting people to go back to the same level of restriction that we did in the first wave, I don't think will be something the public can buy into. We need rapid tests to be deployed and distributed freely to everyone. We need to empower people to make decisions intelligently, so that they can go about some degree of normalcy while not panicking entirely about Omicron. And until we have that balance, there's going to be too much uncertainty. And frankly, our healthcare system is going to be at risk if we simply go on as is.
Yeah, Dr. Razak, I want to bring you in on this. Are you concerned about the impact on the healthcare system, specifically hospitals, ICUs, when we talk about just how aggressive the Omicron variant is?
Yeah, absolutely. It's a source of concern. So what we're seeing is a version of the virus which is clearly much more transmissible, potentially as severe, maybe less, as some people have said, but really no clear evidence of that. And if those two things go together, that predicts a large surge of cases, and many of those will require a hospital admission. Some of them will require an ICU admission. The structure and the staffing of our hospitals is not as robust as it was at the start of this pandemic. Our staffing is much thinner. People are much more fatigued. It is harder to care for a surge of patients coming in now than it was 6, 12, or 18 months ago. And so I am very concerned. And I think part of what the next few days are going to show us, and it's really days with Omicron because of the degree of spread and how fast it's growing, is what the start of that uptick looks like. And part of the response, and unfortunately, it's going to be during the holiday season, is can we hold the line and prevent another wave from flooding into hospitals?
Dr. Grill, Dr. Moore said today when it comes to holiday gatherings that we should all take a personal risk assessment and consider our options going into the holidays. If boosters become more readily available to more people in Ontario, if that's announced tomorrow, could that change things over the holidays? What would your advice be?
Yeah, so the first piece of advice I would be on your last point is that I would encourage everybody that's eligible for a third dose, and I'm calling it a third dose because I think that this really is a 3-dose vaccine at this point, and that everybody who's over 18 and 6 months out of their previous second dose is going to need a third dose at some point very soon because of waning immunity. So I would just recommend, and I've told all my patients, when your time comes, please register for the vaccine as quickly as possible. And we know, as my colleague just mentioned, that there's evidence that getting that third dose will protect you both against the Delta variant and Omicron, which is spreading as we're learning more about it. In terms of holiday gatherings, I think Dr. Moore puts it very appropriately when he says that we can't reduce risk to zero. This is all about risk reduction. And we have to keep reminding each other as we get tired and fatigued that what we've done so far during this pandemic has worked. So things like keeping your holiday gatherings smaller, right? The less people, the less contacts, the less chance you're going to spread around COVID-19. I would encourage people to only have guests over if they're fully vaccinated, particularly if they have their booster dose. That will keep more people safe. Open a window, tell them to bring their favorite holiday sweater with them so you can improve ventilation in the home. And if you're having people in your home that are immunocompromised or older that have complex medical issues, either decide that maybe this year you should just have it with immediate family, or if you're going to have other people over, particularly the people that are immunocompromised, they might want to wear a mask and be a bit more physically distanced from the rest of your guests. So again, the things that have kept us safe from our public health colleagues so far during this pandemic should continue to work against Omicron. But as my colleague, as Abdu said earlier, we have to make sure we're acting as responsibly as possible until we're at a point where cases start to go down and we learn more about the severity of the Omicron variant.
And picking up on that point, Dr. Moore also today spoke about reducing contacts, but he didn't give us, a really clear idea of what that means, of what that looks like. Dr. Sharkawi, do you have any guidance on that? How do we approach this?
Yeah, I want to pick up first just on the point that Dr. Grill was making earlier. In terms of timing, I think we don't want to lose sight of the fact that getting your booster doesn't mean that you put on the superhero suit that very day. Remember, it still takes time for that immunity to be constituted and for that boost, if you want to call it that, or that extra priming effect to take effect. That may take a couple of weeks. If you're older or you're immune compromised, it may take even longer. So bear that in mind. It's not going to change the safety rules with respect to gathering over the next 10 to 14 days, for example. In terms of an actual number, I don't really love the idea of a capacity limit of sorts. I think that it should be guided based on the parameters of who you're with, how big the place is, what the ventilation system is like. 5 people may be potentially risky in a very small, poorly ventilated space where, people are not inclined to mask properly. 12 people may be completely acceptable if you've got an ideal situation where you've got very good ventilation, everybody's fully vaccinated, ideally with a third dose, and is able to practice good public health measures, maybe even do rapid testing. So I don't really love the idea of arbitrary numbers. I think the principle and the real situational awareness is where we need to put our cards down on the table to do this right.
Dr. Razak, at least one school in Toronto is moving to virtual learning tomorrow, the Cosburn Middle School, because of COVID-19 cases. The Ontario Hospital Association has pointed out that these mass vaccination clinics that they're ramping back up again is going to pull resources from hospitals in an effort to get more people vaccinated. If we want to keep schools open and we want to keep our hospitals intact, what could we do, looking in the rearview mirror as someone on the science advisory table, what could we have done to not be at this point?
Well, I think it's hard to say what steps could have been taken just because of the pace of onset of Omicron. It really is unlike, you had Dr. Uni say this earlier today, it's really unlike anything we've ever seen. So a version of the virus we were barely talking about 2 weeks ago will probably be the dominant form of the virus in Ontario by the end of this week, if not in the next day or two. And that's remarkable. And so how much of this could have been prevented? I'm not sure. I really think we need to be forward-looking about this now. And most importantly, the steps that Dr. Grill and Dr. Sharkawi said about the steps from a public health perspective that work to protect communities and protect individuals, good adherence to masking, ventilation, filtration, reducing contacts, ensuring vaccination. That's going to be really important, especially important in the next few days and going forward. And then the rollout of the third dose. And I agree it should be called a third dose at this point and not a booster, because it is the essential dose to protect against Omicron now. That has to be more aggressive than what was already a remarkable rollout earlier in the year. So at its peak, Ontario set a dose record of something in the range of 250,000 doses. We probably need to match something like that almost every day going forward for the next few weeks to really get an important and large percentage of our population protected.
And Dr. Grill, I want to bring you in on this point about mass vaccination clinics returning to hospitals. What kind of impact is this going to have on services that are available?
It's an excellent question. I mean, during the first rollout of the vaccine, I have to give credit, hospitals carried, a very heavy load. They got together with Ontario health teams. It really brought the community providers and the hospital providers together, along with public health, along with pharmacy. There were pop-up clinics set up. Like, it was an incredible effort, all hands on deck. And at one point, I think we were immunizing about 200,000 people a day in Ontario. Now, what Dr. Moore has sort of asked, along with the Ministry of Health, for all of our partners, again, is to try to spend the next 10 to 14 days ramping up again. Now, whether we can do that quickly remains to be seen. As my two colleagues mentioned, healthcare workers are tired. We don't have the same health and human resource pool that we did earlier. But, primary care was sort of asked, along with our other colleagues, could we focus our offices, which are much busier now, by the way, because patients are much more comfortable coming to see us now that they're fully vaccinated. Could we sort of focus more on the essential acute care services and maybe hold off on some of the non-essential things, which is really a judgment call, because we don't want those patients heading right to the emergency room. That's the last thing we want. And spend some of that extra time vaccinating. And whether we can do that in our offices or whether some of these mass clinics can open again. I had a meeting this afternoon with York Region Public Health. They're trying to extend some hours. My own Ontario health team through Markham Stouffville Hospital has their clinic open. I'm working a couple shifts a week. So we're going to try to enhance that as much as we can. And aside from just vaccinating, primary care can do other things that we've tried to do since the beginning. We can communicate, so we can talk about the importance of boosters. We can put on our websites how to register for the vaccine, what the 1-800 number is for people to sign up. We can continue to collaborate with our partners and send patients to pharmacies or to other primary care colleagues if we don't have the capacity in our office. And finally, we can continue to educate on how important it is right now to go out, get your shot, and follow the public health guidelines. So primary care is going to do our best, but I think this is really all hands on deck. And whatever capacity the hospitals, public health, pharmacy, and primary care can give now, we're going to try to do it. And we're going to try to do our best to move forward, get ahead of Omicron as best we can, and hope more people come and roll up their sleeves.
Dr. Sharkawi, as an infectious disease specialist, if our population was 100% vaccinated before Omicron reached here, would it have as much of an impact?
Well, certainly not. And I think obviously the $64,000 question is, what is the real impact in a highly vaccinated population? I don't know that we have the answer to that based on the rapidity of its spread and, just looking at real-time data almost on an everyday basis. I think that what we've learned in this pandemic is there's no one single way to control this virus. And I think that's the guiding principle that we need to continue to follow because these curveballs, it's Delta not that long ago, now it's Omicron. We can't simply rely on vaccination. We've got to dovetail that with other things we know work very well. And that means masking in indoor spaces, particularly around others whom we don't know the vaccination status of. It means being careful about ensuring that ventilation standards are up to par or spending as much time in well-ventilated settings. We need to do those things that overlap with vaccination as we continue to fall on this concept that vaccines and everything else can simply be ignored. Well, we're going to end up in hot water, and that's the exact reason why these variants continue to emerge. It's because you need two hands to clap, and even though it's a very strong hand with the vaccines, it needs some help from the other side, and that means other public health measures.
And speaking of public health measures, Dr. Razak, no new measures announced today by the province, but we could be seeing more announced later on this week, as soon as tomorrow. What would you like to see the province come out with?
I think it has to be on the table, and I say that with dread heading into the holiday season after what everyone has been through. But in order to slow the spread of the virus, as Dr. Sharkawi said, you can't rely on just vaccines. We can't get them out fast enough. They take time to work, probably at least 2 weeks. You need to do something else at the same time to reduce the risk of uncontrolled spread, overwhelming individual sickness, and our health system. And so public health measures, I think, are part of that strategy. And in the coming days, I hope that we start to see some of those. And, the things that we saw early in the pandemic that worked included restrictions on capacity, mandates, masking and vaccination mandates, both of them. And then there are these large venues which are still open, which probably are not reasonable thing to keep doing in the middle of this wave. And, the stadiums and other large gatherings, just not something that realistically can be done safely anymore.
All right, Dr. Rezek, Dr. Grill, Dr. Sharkawi, we appreciate you making time and offering us these insights. Thank you.